Hey everybody, this is Allison from Thriving While Disabled. So today I want to talk to you about something that's going to be in the post I put out tomorrow and that I've mentioned in a previous post. And that is ableism and sexism and racism in medication design and testing. Yes, heard me right. So medication is covers a lot of territory, but basically there are protocols in place for the research, design, and testing of new medications that people can take, and research and design is one of those really big and important topics. So the first piece of the issue is that given all of the statistics on just people who get their MDs, are trained as researchers and things like that, the people designing medication are predominantly white men. And so they're more apt to think about and understand white male problems than problems experienced by women or problems experienced by other races. So the very base of this is a lack of diversity in thinking. And if you want to bring ableism into it, absolutely. Most of these folks are also not disabled. So that's the first problem. The next thing is that testing in almost all phases is predominantly done on men, especially white men. Even going back to the initial testing done in rats, it's almost always male rats that are tested. So unless they're very specifically looking at female reproductive systems and things like that, even then I'm not positive, most of that testing that they do is done on male rats. So they're dealing with testosterone, they're dealing with male hormones, not female hormones, and so they just don't know for sure how these medications interact with estrogen, interact with the female reproductive system, things like that. So that's one piece. Then eventually you get to what they call human trials. And one piece of human trials is testing on, people went by, is testing on, first there's a round of testing for human trials where they're testing to see if there's a really bad reaction. And for that part of the testing, they do have somewhat reasonable representation of non-white people, and in some cases, women. But testing proceeds, and when it comes to testing around dosages and what amounts are most helpful, things like that, most of the people they are testing are, again, white men. Except if they're testing something specifically for women, in which case it's white women. So there's no, and in many cases, even when they do test on women, they don't necessarily mark which patients they're testing are women or other important details, so you can't tease out the data later to see if you can get information on the effects on women specifically as opposed to men. And same thing when it comes to race. Even if they have one or two people tested who are Black or Latino or whatever other identity, they don't necessarily identify them as that, so you can't, and only one person isn't enough data to make a big analysis anyway. So they don't identify that information, which means when it's time for your doctor to prescribe medications, all of the dosage information, all of the side effect information, all of those kinds of pieces of information are built off the responses of white men. And they know that estrogen and can have an impact. They know that women's body chemistry is different enough that sometimes the side effects can be significantly different. They know that female symptoms of things can be significantly different. As an example, heart attacks. The signs of a heart attack that you generally hear about are typical male heart attacks. Women have a somewhat different set of symptoms. Thank you, Webb. Have a different set of symptoms for heart attacks even. So it wouldn't be surprising if the difference is also there in how the medication affects your body, in what dosage is appropriate, things like that. And that means that doctors have to do a lot more experimenting to get the right dosage for their female patients. And when it comes to race, it's even worse because, again, there hasn't been enough research to even recognize what those points of genetic difference necessarily are. So recognizing those points of genetic difference is really important, and that research isn't being done. So an example from an article I was reading was talking about how there's a huge upswing in the number of Black children with asthma. And it looks like asthma is a genetic, has a large amount of a genetic component to it, which means that the treatment that's appropriate for Black children as opposed to white children might be extremely different. But all of the research, all of the testing, all the way through is focused on white men, maybe white male children, but not on Black kids, not on Black male kids, not on Black female kids. So there's these extra variables in place that nobody's doing the research on. And so people simply don't know if that medication will work similarly well based on race, or if that, or if there's a better medication for that race or that gender. So the whole system is really deeply flawed. Now, the government has been pushing to have better representation in the testing. But again, until a large number of people are willing and able to participate, and more importantly, know that there's an option for this, it's still unequal testing. And again, if they have too few people, it's a variable that can't be researched, and they might bury the information on the one Hispanic person who participated in the trial because they can't make a statistically significant determination from only one person. And depending on the size of the trial, they probably can't from just two. So it's a really big problem. And again, like I was saying, it looks like most of the efforts to increase the diversity in the testing is being done at an early stage when it's about, is this safe? As opposed to a later stage when it's about, how effective is it? The is it safe testing is the stuff that usually involves being paid for it. And the how effective is it is more often run by a different set of doctors who are looking at their patient populations. And of course, Black people are generally underrepresented in those patient populations, which is another piece of the problem. The whole field of of doing the testing properly is rife with challenges. And so we're in a really tough situation right now. Is there a simple, obvious fix? No, there isn't. But one of the biggest problems they've found African American people have with being participants in testing is very simply they can't really trust the white doctors doing government experiments because of the history of just how deadly it's been. If you look at the Tuskegee experiments, and there's a lot of more modern, that understandably makes people very hesitant to participate in a clinical trial, you know? And so it makes it all very, very tough. And a big part of it is a lot of Black people recognize that they're not getting the top quality medical care. They're not getting listened to enough. They're not getting support enough from the medical community in general, and they don't feel safe there. And so the more that can be done to help Black patients feel listened to and be able to trust their doctors, the more likely they are to be willing and able to participate in studies. What's going to push that? Well, the more that the government insists on racial and gender diversity in drug testing, the more they're going to have to work to get that in order to be able to test their drugs. So one of the things that can be done to help this is policy changes. So I'm going to try to keep my eyes open too, but if anybody learns about drug policy changes and testing changes, that is a form of legislation that we as a disabled community could benefit from. Because again, the disabled community is full of people of all different genders and races. And the better the data is about our medications, the more likely we are to get better treatment. And the better patients are treated, the more likely we are to get better treatment. All right. Everyone take care. And today I'll link in the post that I did a while ago about thinking about medications and drug interactions, because it is very possible for you to take a mix of drugs that can make your health worse. And tomorrow I'm going to be putting out a post specifically on systemic inequalities, including especially focused on racism. And in there, I've got a section specifically on the medication issues. All right, I want everyone to take care, and I want all of you to keep thriving.